Welcome to Your Health, a podcast from the Hoosier Ag Today presents your Purdue Extension Podcast Network, where we connect you with the experts and resources helping Hoosiers live healthier lives. I'm your host, Greg Allen. You know, March is National Nutrition Month. It's a time dedicated to highlighting the importance of making informed food choices and delivering healthy eating and physical activity habits. This year's theme focuses on building sustainable, balanced nutrition habits that fit into everyday life, something that's especially important for families across Indiana. Today we're joined by Abigail Creigh, who is the Health and Human Science Educator for Purdue Extension in Noble County, to talk about how nutrition education is making a real impact in our communities. We'll explore what makes Extension programs unique, the kinds of classes and workshops available, and why reliable research-based nutrition guidance is so critical, even in a world full of online information. So we're very excited to have you here today, Abigail. Thank you for joining me.
Thank you for having me, Greg.
You know, one of the main reasons we wanted to have you this month was because this month, March, is National Nutrition Month. So tell us what this year's theme is and what is the significance of March?
Of course, yes. Happy National Nutrition Month.
Yeah.
But it's an annual campaign. National Nutrition Month is an annual campaign by the Academy of Nutrition and Dietetics. And during this month of March, we like to invite everyone to learn about making informed food choices and developing those healthful eating and physical activity habits. The theme this year is Discover the Power of Nutrition. You know, in that nutrition has the power to help individuals and communities thrive. Discover how food and beverage choices can help power your day. And whether you're looking at all those nutrition headlines or if you're just searching for nutritious options, or maybe you're just wanting to boost your confidence when it comes to food and nutrition, seek out a registered dietitian. We can typically help guide you with information that is driven by science.
It's kind of crazy to me that March is National Nutrition Month, and the reason being is because, and we were talking about this a little bit before we went on air here, it's such a bipolar month with the weather. And so, yesterday we were out walking. Today, I don't feel like walking when it's, only 40 some degrees. What are some things that we can do to stay active when it is cold outside?
Active during the winter months. Wow, there's a lot of different ways. I love when I'm at a grocery store or we have a local community center and there's all these walking groups. So, they'll have different days, time of the day that they meet and they walk together indoors. So that's a wonderful way. You kind of have that buddy system. It keeps you accountable. But if you can find, locations, the mall, large supermarkets, again, large community centers that have that space where, you might even be able to get some stairs into your walk. That's a really great way to stay busy and stay active during the winter.
I may have gotten ahead of myself. I just wanted to talk about how crazy the weather was. Abigail, can you tell us about your role as a registered dietitian with Cooperative Extension Services?
Sure, yeah. As a registered dietitian with Extension, my job really is to just bring that practical, research-based nutrition information directly to the communities. That means just providing those programs for our families, for schools, local partners to help people again make those healthier choices that fit their lifestyle, their budget, and their health. It's connecting people to that sound, reputable information to assist them with those nutritional choices.
So, what makes extension nutrition programs unique? I mean, compared to other health services that are out there?
Yeah. Well, first and foremost, extension nutrition programs really should be a continuation of any healthcare services or health professional recommendations that someone has received. Um, and then I always like to share the community is my classroom. And I personally really feel that this makes extension programming so unique and that I get to come to you. I can meet you where you're at. Whether that's holding a program at your business, your church, your school, maybe an organization where you volunteer at, you know, I can bring the program to you. Or maybe it's that, you and your friends join me online for a nutrition session, via Zoom or Teams platform. But these programs, then we can set it up where it might be a single session or a series. And when we can do a series, that's an opportunity where we can really start to build upon the knowledge and the skills, and get to know the people that we're having that impact on. Um, Purdue Extension also has, numerous educational resources available, not only in our offices, but, through our website. You can download it, you can buy it through Extension Services. So, yeah, nutrition noise is loud. So you don't have to filter through it alone. Extension programs are here, really to support you every step of the way. And again, we're a continuation of that healthcare.
Well, let's get in a little deeper in the weeds on those programs. What kind of classes, what kind of workshops do you offer? Can they take part in?
Yeah. Okay. So I'm going to kind of speak to my area. I really like to focus primarily on three main nutrition areas with my programming in the communities. First is food safety. So, how to properly handle and keep food safe. In Indiana, many families, we buy meat, poultry, eggs from local farmers, even raise our own. So, food safety is so important. Making sure that we're cooking food to the right temperatures, that we're washing our produce, and basically just hot food hot, cold food cold, because we want to prevent those foodborne illnesses. Um, Keeping our food safe really is an important or a key aspect of protecting our health. So, two of the main programs that I share in the communities on a routine basis in regards to food safety is programs from the National Restaurant Association. We have Serve Safe Food Protection Manager, and that is a 5-year certificate training and examination course, primarily for food service establishments in the state of Indiana, and throughout the nation. And then we have Serve Safe Food Handler, and this is a 3-year certificate. And I would say the majority of individuals that sign up for that class are other food handlers within the food service establishment. They might not be the manager or the supervisor. We have nonprofit organization volunteers, if they're doing a lot of different fundraisers where they're serving food to the public. And then also, it's an excellent course for home based vendors. My second topic that I'd love to share or kind of highlight in my programming is food preservation, especially during the busy harvest season here in Indiana. Food preservation is such a tradition here in Indiana, but learning how to safely can those tomatoes or freeze those green beans, preserve that fruit, of course, it lets us enjoy that food safely all year long. We also find that when you're preserving your food, of course, you're kind of stretching that food budget. You're reducing food waste. So it's really important that we're, of course, using safe, tested methods when we're doing this. So, we want to kind of get away from that common myth that old methods are always safe because, things have changed over time and we want to prevent illness. So with Extension, our hands-on workshops and even virtual programming that we do in regards to food preservation, it's really important that we're stressing to our participants that you're utilizing up-to-date research-based guidelines when you're preserving your food, rather than that, those old recipes or even word of mouth. We do have a program going on right now. It's a 5-session series, and we are offering it virtually. It's been a lot of fun. I think we're at week 4 this week, but it's been a lot of fun. We've had very good participation. I think we are up to like 85 people, and we have individuals from 11 different states. So that's been super exciting. But like I mentioned, our team of Mastering Home Food Preservation instructors with Purdue, we also offer those hands-on workshops, which is really important when it comes to safely preserving our food, is actually going through the motions, and utilizing and referencing those up-to-date recipes. But that's happening across the state of Indiana, and primarily during our harvest season. And then
my wife is going
my
to be
third
super excited
topic.
that I'm talking to you today. She is all about canning, wants to learn more and more about it. So I'm going to have to tell her that you offer that
Perfect.
program. She'll be super excited. Sorry for interrupting. Go ahead.
Yeah. No, thank you. That's exciting. Um, the third topic that I like to share in the communities is around the role that nutrition has in risk reduction and management of chronic diseases, such as diabetes and heart disease. Um, Chronic diseases like heart disease and diabetes really affect many Hoosiers, but of course, nutrition can make a big difference. And so, our programs, we like to focus kind of on those simple habits, maybe encouraging that we're cooking more meals at home, that we're reducing that sodium in our diet, balancing our plate with those whole grains and quality protein, and of course, plenty of fruits and vegetables. So we like to encourage just those simple habits. Using local ingredients can even make healthy eating a little bit more accessible and really enjoyable too. So some of my favorite programs in that regard are Dining with Diabetes. Food Allergies 101 is another favorite one. Gluten Free, the Gluten Basics, and then also Be Heart Smart. So those are a couple of my favorite programs around chronic disease management.
With all the different programs that you offer, it kind of sounds like you cover the gambit of all demographics. So I guess the question will be, who do you primarily serve then in your community?
So my programming it is primarily geared to kind of impact adults, I would say. However, I do partner with FACS and health teachers to assist in bringing additional food and nutrition education to the schools. And I also work with fellow 4-H educators to hold food and nutrition programs for our 4-H youth. We actually are getting ready for a full day tomorrow. We have 18 I don't know if they're all 4-H yet, but they're all youth. So we have 18 youth for a 6-hour day of cooking. And we're going to
Oh, fun.
cook and we're going to talk about fun different kitchen gadgets and, of course, food safety. That will be on the agenda.
Well, I'm sure if they're not 4-H, they probably will be by the end of that.
You
That
will
sounds
be,
like fun.
definitely.
Well, Abigail, we've got to take a quick break, but when we return, we're going to talk about one small change that everyone can make to improve their nutrition. So stay tuned to Your Health.
There's so much fear when people realize people have hit rock bottom. Sometimes what can make that difference with that person is just the fact that somebody acknowledges them. Sometimes just not being afraid to start that conversation and just be that ear for that person. And that may be the one thing that could change everything.
Farmer suicide rates are significantly higher than the general population. That's why Purdue Extension offers the Purdue Farms Trust Team to offer help when it's needed most. And we're back with Your Health, and we're talking today with Abigail Creigh. Abigail, thank you so much again for joining us today. Tell us, Abigail, how does working in Indiana shape the way that you approach nutrition education?
Well, in our Indiana communities, I really feel it's important that we kind of focus on those practical skills that we can utilize right away. We want it to fit our audience's lifestyle, because if it does, then I feel like it's going to stick more. And again, it kind of goes back to those practical skills that we can utilize right away. That might mean teaching someone how to safely preserve, their garden harvest. It could also be just preparing quick, healthy meals. It's kind of what we're going to do tomorrow with the kiddos is, introduce them potentially to some different kitchen gadgets that they could utilize themselves to prepare those healthy, maybe after school snacks. Even too, just making small changes to manage those different health conditions. But really, we try, everything that we teach, again, it's realistic, it's practical, research-based, of course, and tailored to our audience as best as possible.
There's so much information online. You can literally find anything on there. So why is nutrition education, like through a program or programs like you are involved with, why is it still so important?
Well, there's a lot of information out there, and not all of it's accurate, not all of it's practical. So through our extension programs, we really try to cut through all of the extra noise, and provide our participants that science-based guidance. It's information that people can trust, and more importantly, especially when we get the opportunity to be in person and kind of hands-on, we can really show them how to apply it to their life. Again, whether that's how to properly cook, keep your food safe, grocery shopping, meal labeling, and just, those basics for feeding your family.
There's just something that really sticks to you when it's one-on-one, isn't it?
Yes. Oh, definitely. Much bigger impact. Again, we get to know the individual. And we, again, like I said earlier, we can really build upon that relationship and just that knowledge that we're sharing back and forth. Sometimes a lot of times it's a two-way, but just really building upon those practical skills.
Okay, Abigail, we teased this before the break, but let's talk about the one small change. Let's talk about one small change that listeners can make right now to improve their nutrition.
Yes, that's a good one. Oh wow. So as a dietitian, I have so many, but probably my favorite, one simple step, especially here in Indiana, is definitely to take advantage of what is in season. So whether that's apples in the fall, sweet corn in the summer, even frozen Indiana grown vegetables, that you get to enjoy during the winter months. Just adding those extra fruits and vegetables to your plate is a really good place to start. And if we plan and we prep those fruits and vegetables ahead of time, we're more than likely to actually eat them.
That's right.
And of, yeah. And of course, I've got to add in my food pres. So if you safely preserve them when they're in season, you'll save money and you'll be able to enjoy that produce, all year. Definitely in the off season.
It just tastes a little better when you work for it.
Mm-hmm. Yes.
What is one takeaway that you hope everyone remembers from today's conversation today, Abigail?
Well, with March being National Nutrition Month, I do encourage all Hoosiers and everyone, to focus on those simple habits. Nutrition can be very, very powerful. It can make a huge difference. So enjoy those local foods, enjoy preparing meals at home, and of course, always keep food safety in mind at all times. Whether you're picking up produce from a farmer's market this summer, or you're preserving your garden harvest, or maybe you're just making those small changes, like I said, adding more fruits and vegetables to your plate, maybe to potentially help manage some of those health conditions. Just know that all those steps, all those little interventions are really adding up over time. And Purdue Extension, we're here across Indiana, and our goal is to provide trusted, practical information and support for you, for your family, throughout the whole, every step of the way, basically.
Awesome. So where can people go to learn more about your programs?
Well, Purdue Extension currently is in all 92 counties in Indiana. So I would recommend searching for your local extension office. If you find our address, you can come on in and visit with us in person. Give us a phone call. We like to talk to people on the phone still. or find our website. Google us. You can Google Purdue Extension. And of course, Extension is visible on all the social media platforms like Facebook and Instagram.
You are not hard to find. Abigail Creigh, thank you so much for joining me today. This has been a delight.
Thank you so much. I appreciate the time.
That's all for today's episode of Your Health. A big thank you to our guest, Abigail Creigh, for sharing how Purdue Extension's health and human sciences programs are helping individuals and families across Indiana make healthier choices every day. If you're interested in learning more about local nutrition classes or workshops or resources available in your community, be sure to connect with your local extension office. Remember, good health starts with informed choices, and sometimes the best guidance comes from right here at home. Thanks for tuning in to Your Health, a podcast from the Hoosier Act Today presents your Purdue Extension Podcast Network. I'm Greg Allen. Stay healthy.